Hey, this is Dr. Moss with Moss Rehabilitation Center coming to you today with a few questions that we frequently get regarding shoulder pain. So I thought I'd just shoot a quick video, talk to you about the common questions that we get and some of the answers that we frequently give our patients in the clinic. One of the most frequent things that we hear are that people, they've injured their shoulder, but they really don't know what they did. So they didn't really have an injury, but their shoulder hurts. And really we see that in different parts of the body, but today we're talking about the shoulder. So it could be something where, you wake up and you've got pain in the shoulder, not really sure what you did, and it just continues to nag and ache. And it could be anywhere from kind of the side of the shoulder, it could be running up into the neck, and sometimes it even runs down into the arm just a little bit. So if that's the case, what should you do? Should you just run out to the doctor? Should you run and get an MRI? Do you need to go get an X-ray? Do you have to have surgery? So I'll hopefully dispel a few of those myths and talk about that today. So one of the first things you can do is, if you have an injury, you've done something. The body is irritated and it's mad, and likely there's some type of inflammation in there. And so one of the easiest ways to help control the inflammation is just ice the joint. And so if you've had pain within probably the first 72 hours, about 3 days, ice tends to work the best. After that, I like a mild heat pack, because that's going to help increase the blood flow to that area, help carry off some of those inflammatory agents that your body produces, and that blood flow also helps with the healing process. So in the first 72 hours, go in and ice the joint. If you don't have some type of kidney or stomach issue or liver issue, then you can also supplement that with a little bit of ibuprofen or Tylenol. There's also some really good kind of over-the-counter homeopathic type remedies that you can do. So you can look some of those up on the web, and I'll try to find some of those names for you, and I'll post those in this video as well. But I think curcumin is one of them. There's arnica is another one, and there's some other rubs and creams that you can use on that shoulder. And really what the rubs and creams do is they kind of block the pain. So you imagine all the pain centers are going up to your brain to tell you that you hurt. And let's just use a arbitrary number. Let's say that once those pain signals reach 100, then it registers in your brain that you have pain. And so you've done something to the shoulder, and now those sensors are like to 120. Well, if you put ice or heat or a hot, icy hot rub or something like that on that shoulder, what that does is then that starts to increase the amount of good signals that come up to the brain, and starts to shut down those painful signals. So really, it's not getting deep down into the tissue to really fix the problem, but it is starting to kind of mask and block the pain just a little bit. So that is helpful. Definitely recommend that, because nobody wants to walk around in pain. The next question that we get a lot is, okay, my shoulder hurts, and how do I sleep? Because I have to still get up and work or take care of the kids or go to school. What do you do in that case? Well, if that's the case, then first thing you want to do is try to avoid sleeping on that shoulder. You can do that by using several different pillows within the bed to kind of block you. You can maybe shift sides of the bed. If you're used to sleeping on one side versus the other, you can change and do that. But blocking with either some different towel rolls or some pillows seems to be the best. The next thing is, if you have a recliner, go sleep in the recliner. So being in that slight inclined position, that can prevent you from rolling over onto that side. Next, the other thing is, what else do I need to do to prevent this from getting worse or making the problem, even more involved? And really, the first thing with shoulder is you want to avoid reaching overhead and even carrying and lifting heavy objects with that arm. Now, I know that sounds like common sense, but a lot of times people will forget, and they'll reach up into the cabinet just to get a glass or a cup of coffee, or a coffee cup. And when they do, that will irritate the tendons, it'll irritate the bursa, which are all kind of the soft tissue that's in the middle of that shoulder joint. And when that irritates the bursa or the tendons, then the pain continues to get worse. So really, you're looking to avoid irritating that tissue within the joint. The other question we frequently get is, how long is this going to last? And it really depends. It depends on, did you really do something to injure the shoulder? Has this been a long-standing problem that now it's decided to, flare up, and now you have your symptoms? Did you really tear something, or is it something just mildly inflamed and irritated? Ideally, within the first 2 to 3 weeks, the pain starts to subside and you can start to regain some type of mobility and strengthening type program. If the pain is continuing to last after a couple of weeks and you're not getting any significant relief, then that's the best time to maybe look at doing some other type of therapeutic injections or some other, make sure you're doing some formal therapy at that point. Those sorts of things, something, we can help you with here at the clinic. Because the longer you just let it sit and just rest and hope that it gets better, the longer it's going to take, since you're not truly addressing the problem. So if you just sit back and let it, kind of heal on its own, that's fine. But what happens a lot of times when it heals on its own, you end up coming back, a little bit weaker, and you also come back with decreased mobility in the shoulder. And it's a slight, subtle change that most people don't recognize. But what happens is then it sets you up to have this problem again and again and again because you didn't really address the underlying problem and you didn't fully restore your strength and your mobility. Do I need a X-ray or MRI? Very common, very frequent question that we get here in the clinic. And the answer to that is usually no. So if you've not had some type of traumatic onset, say you're throwing a ball or lifting really heavy bags of feed or something like that, more than likely an MRI it's going to show some normal degenerative and kind of wear and tear within the joint, and it's not going to tell you as much as you would think. And an X-ray is really only going to be useful if you've had maybe a fall, so you want to rule out some type of fracture. Other than that, you're just really looking at the bony tissue, and it's hard to see any of the soft tissue in there. So an X-ray is rarely necessary unless, again, you've had some major trauma, some type of fall or car accident. So what else should you do? And so, rest it for a couple of days, take some type of anti-inflammatory, some natural stuff, use it in some ice, and then you really want to get back to general use of the shoulder. Very easily start to work back into your full range of motion where you can start to reach, overhead and across your body and out to the side, but you want to go gentle. So you don't want to keep pushing into the pain. This isn't a situation where no pain, no gain is what you're trying to do, because if you do that, you'll continue to irritate the tissue. And then if you continue to irritate the tissue, then what happens is the pain just continues to get worse and it continues to cycle back and forth. So you certainly want to avoid that. The next thing is doing some general range of motion, some gentle strengthening type exercises. In the clinic, we have some other things available. So we can do deep tissue laser, which helps speed up the healing process. It uses light naturally to penetrate into those inflamed tissues to reduce that inflammation. It works really well. And if there's some tight muscles in and around the shoulder joint, then we can also use therapeutic dry needling. So it's a form of acupuncture to help reduce the local pain that helps take tension off of those tendons within the rotator cuff and allows them to heal frequently. So if you're experiencing some shoulder pain and discomfort, you're not sure what is going on, what else you should do about it. So what you can do is contact the clinic or just reply to this email. We'll be more than happy to do a free shoulder PT checkup. It's about a 20-minute visit with myself or one of our other doctors of physical therapy. We'll evaluate your shoulder, ask you a few simple questions to see what's going on and see what's the best course of action for you to help you get back to your shoulder mobility. Also coming up on February 6th, we have a shoulder pain workshop. So if you're not really sure what to do, but maybe you have some questions and just want to learn a little bit more about the shoulder and what we do here at the clinic, then feel free to register for that workshop as well. You can call the clinic, 817-220-6677 to get registered, or we'll include a link in this email. So hopefully this has been helpful. If you have some other questions or comments, please leave them down below or reply to the email that you receive, and we'll be more than happy to answer those in the next video series. Thank you.